Good morning, everybody. My name is Deborah Byrne from Deborah Byrne Psychology Services, known across social media as DBpsychology. And this morning I'm going to talk about this week's blog, which was all about histrionic personality disorder. Now, you can find the blog at www.deborahbyrnepsychologyservices.com. And the reason I do these blogs is to highlight the personalities and the different information that you might need if you come across somebody like this. Or if you have a condition and you want to know, some basic information as to, why you have this condition, or how it's diagnosed, or how your wife has the condition, and where you can go and get help, basically. So in this case, it's we're talking about a personality disorder. Now, personality disorders are divided up by the Diagnostic and Statistical Manual, which is edition 5 at this stage. And that just means that it is a manual that is used by psychiatrists and psychologists to diagnose different conditions, different mental health conditions. And that includes, in this case, personality disorders. The personality disorders are then divided up into 3 parts, or 3 clusters. There's cluster A, cluster B, and cluster C. Now, so that's an awful lot of information for you, but it gives you the baseline of where histrionic personality disorder fits in, and that's in the cluster B group. That just means they're part B of these personality disorders. And the histrionic is grouped with antisocial personality disorder, narcissistic personality disorder, and borderline personality disorder. A pretty tough group, I have to say, a pretty tough group. I've talked about narcissistic personality disorder before. I've talked about antisocial personality disorder before in general. And I've also highlighted that psychopaths and sociopaths are also part of that group under the antisocial personality disorder. So as you can say, this is a pretty tough group. And in there, the histrionic, have to get this right, histrionic personality disorder is placed. And basically these are types of people, and this is a very simplistic, what they're like, very, very simplistic definition of what they're like. They are people who need your approval. That's what their baseline is. They need others to approve of them in order to feel human, in order to feel normal. If you're thinking about that, that's a pretty tough thing for somebody to have to deal with. If you are a family member, or if you're a friend, or if you're trying to have a relationship with somebody like that, they constantly need your approval. But not only that, their behaviour tends to be very dramatic and also inappropriate. So they will act inappropriately in all ways, shapes and forms. So we're not just talking about sexually inappropriate, we're talking about everything. How they speak to people, how they deal with people, everything about them is very drama orientated, very inappropriate in its context. The symptoms that I've listed are very, very long. There's a few I'll just pick out, and that would be, they are people that are easily influenced. They are also very much preoccupied with how they appear, how they look. They're very self-centered. They are very difficult to have a relationship with. They very much fail at maintaining relationships, and that's not just intimate relationships. That is also with family and friends. They have no boundaries, absolutely no boundaries, and they will use threats of suicide, or even attempt suicide. As I said, no boundaries, inappropriate behaviour. They will use this to manipulate you. So in having said that, you can check out all those symptoms, a very, very, very long list of symptoms that are there. and you can check them out. And as I said, it's at www.deborahbyrnepsychologyservices.com. Now, in terms of what causes it, we don't really know what causes it at this stage. We do know that there are signs that it is linked to in being inherited, and it can run in families. So, and I've gone into detail of how people as children could develop this personality disorder because of the way they've had to act as children, the way they've had to get the parents' attention and approval, that this might nurture this up. And as I said, it's a personality disorder that is very much preoccupied with their appearance. So given the age that we're in, and it's a social media age, you've got to, if you've got to think, well, if it's something that can be developed from childhood, and somebody that is very preoccupied with how they look, you've got to ask the question, how is the current social media usage affecting somebody like this? How are they affecting our children? It gives rise to that question, but that's just something to think about. Now, in terms of treatment, diagnosis will have to be by a psychiatrist, and treatment would be very much, as always, with any treatment for any mental health condition, is always tailored. But in this case, we're very limited in what we can do. You have to have cooperation from the patient when you want to treat somebody. You're not very likely to get somebody like this with this personality disorder. Remember the group that they're in. They're in there with the psychopaths, the sociopaths, the narcissists, the antisocial behaviour, borderline personality disorder. Very, very unlikely to come to get treatment. What's likely to drive them into treatment is conditions that can arise from having this personality disorder, which is depression, anxiety, and being highly stressed, being very stressed out, very, very burnt out. Remember, they have to maintain this personality. It's a very demanding personality, so they'll be highly stressed. This may drive them in to treatment, and that is what they would initially get treated for. With this type of personality, the usual CBT and family therapy is not effective. You need psychotherapy with them. You can use CBT, but it cannot be the sole focus of the treatment. It has to be used for maybe treating the depression, maybe using as part of treating stress and anxiety, and treating the the depression. It could also be helped using their maybe grief. Maybe they're grieving out the loss of relationships. They cannot maintain the relationships. That may have driven them into treatment. So it could be used there, but it cannot be the sole focus with these people, because it is very, very ineffective with them. And as I said, you're going to be using psychotherapy. Again, medication would be only used to treat the other conditions, not to treat the personality. You can't treat the personality disorder with medication. Family therapy, as I said, family members, loved ones, a lover, partner, husband or wife that is in this relationship may look to have couple counselling, may look to have family therapy. Very difficult. I have to be honest with you, that would be very, very difficult. You would have to, you have to have the cooperation of all parties involved. Not likely to have this with this type of personality. And in saying that, what I would suggest to somebody, if you have a family member that is like this, you're going to need a diagnosis first and foremost. So head off to the GP, maybe have a chat with the GP. And if it was a child and you suggested, well, it'd be a teen, it'd be probably a teenager, mid to late teens, you would get to an idea of, okay, there's something really wrong here. We go to our GP, the psychiatrist then diagnoses, you go on to the psychiatrist, they diagnose. My suggestion to you would be to go into therapy yourself. You're going to need it. They have no boundaries. These people have no boundaries. So you are going to need a lot of support. You're going to need a lot of extensive therapy, probably if you've been dealing with them for a long time. You will need to help with maintaining your own boundaries, setting clear boundaries, rebuilding the trust within yourself. They'll have broken your trust. You'll be second guessing yourself. All the things I talked about with regards to the other personalities disorders in this group, they're going to break all that. They're going to basically break you. So you need to be rebuilt back up if you're in this relationship with them. So, as I said, therapy, learning how to maintain your own boundaries, rebuilding your own trust, basic self-care as always. I'll always harp on about basic self-care. And that is all you can do. Then you will be in a better position as to whether you want to continue in the relationship, or whether, what you want to do with this person. If this person isn't willing to receive treatment, isn't willing to cooperate and change, basically, they're the only people that can change themselves. The goal of their psychotherapy would be to get them to function appropriately in society, for them to realize that they don't have to act the way they are, and that they that they can become, I don't like using the word normal members of society, because I don't like using the word normal. To me, normal doesn't exist, but to act appropriately, as we all do, with respect, and treat other people with dignity, and have appropriate relationships with them. So I hope that helps. And as I said, you can check it. The blog has much more information in it, and you can check it out at www.deborahbyrnepsychologyservices.com. And I'll say again, thank you very much. And thank you very much for my regulars for listening, Deirdre and Colette and Jennifer, Kim and Catherine, who's listening in again this morning. So thank you all very, very much for listening in. And I will see you all again next Saturday morning, and new blog out on Monday. So do check it out. Thank you.